My experience with the Z6 system is that it's a really extremely well-designed system. The flaps, for some reason, actually look clearer than even my LDV treated corneas. I'm not sure whether that's because we're not using a viscoelastic with the system, but even immediately, right after the procedure, the flaps look clearer, and it seems like the patient's visual recovery is very, very quick. That just makes me feel better after I do a case. When I look at the corneas, there's almost no, the epithelium looks almost normal, and there's very little reaction. And so I'm confident that these patients are probably seeing a lot quicker. When they see quicker, they're happier, and they're more enthusiastic that first day after surgery. The Z6 is a continuation of Ziemer technology, which uses small bubble technology. Those small bubbles are a big advantage in the sense that there's a lot less energy that's used as a result of that. The bubbles are actually much more focused horizontally instead of vertically like we see with other systems. That allows us to use much less energy. The cut is much more precise, and as a result of that, there's less inflammation, there's quieter eyes, less problems with OBL and transient light sensitivity syndrome. That results in just quiet eyes day one and a very precise level of correction. The flaps are very reproducible in the sense that if we shoot for a 90 micron flap, we'll be within 5 microns almost every time. That you can't get with a large bubble technology. Our experience with the Z6 is that it's extremely reliable. We haven't had any problems with maintenance on it. As a matter of fact, it's almost maintenance-free. The reason that it is because it doesn't rely on an amplifier, and so it just becomes a much more reliable system. That allows you to be able to move the system without having to worry about the stability of the actual laser. It gives you a lot more flexibility in terms of being able to move it from site to site, or even moving it around within your operating room so it doesn't take up a lot of space, which is a big advantage for a lot of clinics. So to understand the Z system, let's start with the Z2 system. It uses the same small bubble technology as the crystalline and the LDV. The advantages being very high frequency, small bubble technology that overlaps, gives you very, very clean flaps with very little inflammation, no OBL, no cavitation, and the patients are happier, the doctors are happier with that system. Once we move to the Z4 system, we have the capability of actually doing vertical manipulation, which has always been an issue for the system. Now we can make the flap edges any different curvature or shape that we want. You can go as deep or as superficial as you'd like, ranging between 90 microns and 160 microns, as well as designing the flaps. You can even make oval flaps or put the hinges anywhere you want with that vertical capability. In addition to that, we can also make intracorneal ring pockets and also pockets for presbyopic correction for acufocus or other intracorneal inlays, and the capability of that has been well proven in the clinical arena. My experience has been terrific with both intracorneal rings and intracorneal inlays. You really have tremendous control, and that lack of inflammation is actually really quite critical, especially in intracorneal inlays. There's very little inflammatory reaction, and as a result of that, I think the procedure is even more successful as a result of that. When one moves to the Z6, one has the capability of doing full-thickness corneal transplant with that, as well as doing deep lamellar procedures with this. The Z6 also has the capability of going very deep, so if you have a really swollen cornea, you can even go to 1,000 microns, which is far deeper than the other systems currently available. In addition to that, as the Z6 progresses, one will have the capability of doing femtocataract surgery as well as using the OCT guided diagnostic system to drive the system. Those capabilities will really expand things, and the beauty of this is that this can all be done with the same unit. Once you get your unit in your office, the Z2 can be upgraded to the Z4 or Z6 system all within your office. You don't have to send it anywhere. It's all done right there in your office without losing the capability of your laser. I've had a fantastic experience with the small bubble femto technology. It's extremely reliable, causes virtually no inflammation, and the patients are very happy. I have very rare complications in laser refractive surgery, and it's basically because now I'm using femto procedures on virtually 100% of the patients that I treat with LASIK. That's been transformational. It's been really great to do that. And I think it's all based on the small bubble technology and the high reliability that Ziemer has put into the system. In the future, I think that what's going to happen is that we're going to shift back to small bubble technology because it's much more precise, and also it causes such little amounts of inflammation. And so right now we're seeing sort of a proliferation in femtocataract, which is a larger bubble system, but I think we're going to see a migration eventually back to small bubble technology, especially in the cornea, where it's a perfect technique for that tissue.